Hi. So today I'm actually going to show you how to do the antigen rapid test ART test kit at home for self-detection of COVID. Uh, these tests you can buy over the counter at any pharmacy. There are many tests in the market, so obviously check and see which ones are approved in your local region for use, and the instructions on how to use them also vary depending on the kit. So these are general instructions which I've got for the ones which I'm using over here. Yeah, so let's go ahead. So I've already torn open the kit, and in it you find the strip. It's basically kind of like a pregnancy test for those of you who are familiar with it. There's like a marker for it, and then here's where you put the solution into it. Okay, and yeah. So first you put obviously first you like wash your hands, which is what I did. Um, Place the kit on a flat surface. Keep the other things required, the solution, the cap already. Then okay, open out the nasal swab, yeah, and take the swab. You put it in the anterior, the front part of your nose. You put it about an inch deep in. Uh, and yeah, this is the fun part. You have to put it in and rotate it 10 times. Okay, so yeah, uh, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we're not done yet. To do with the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yeah. So yeah, fun. Then you take the swab, and then you take the solution, remove the cover of the solution, and keep it down here. Rotate the swab in the solution 10 times. Okay. Yep, it makes a nice little soup, a really good soup. Yeah, that's an internet joke. Then take out the swab, put it in a nice place to dispose it, and you place the cap which is provided on top of the solution. Okay, make sure the cap is firm, and then you place 5 drops into the kit, and then you wait. Uh, you can wait. You have to wait for the solution to go down. Uh, it starts showing around 5 minutes, but we wait for 15 minutes to get the official reading. Don't wait for too long. So yeah, the reading at 15 minutes is generally the reading that you need to keep. And it's already started. There are 2 lines that turn up on it, 2 possible lines. One is the control. That line is important. That line generally lights up for everyone. If that line lights up, and only that line and not the other one, the T, that means it's a negative test. So yeah, the other one, if both the control and the T light up, that means that it's positive, and you probably have to follow the recommendations in your local area, contact your healthcare provider, and if neither light up, only T lights up and not the control, that's C, then probably the test is invalid, and you need to either repeat the test or yeah, get in touch with your healthcare provider. Yeah, and yeah, here you can see the control is lit up with the line, a little pink line, and the T is not lit up. That means I'm negative. Yay. That's how you read the test. And yeah, all the best, everyone out there. Stay safe. Do give a like and a follow to Slow Motion Thoughts. You'll find I'll do a little science talk from time to time, but she makes some other great contents on things you should know.